Welcome back, everyone. Today's guest is Dr. Neeraj Mistry. I've said it right, Doc?
Perfect.
Perfect. Have you ever Googled yourself?
Yes, I have on occasion.
Okay, let me tell you why I asked this question.
Okay.
So, by the time our viewers and listeners tune into this episode, it'll be the second time that my cousin, Dr. Yak is a co-host on this show. I explained how difficult it was to get him on as a co-host in the previous episode. And this is the first episode where Dr. Yak has been given free reign to call one of his friends and colleagues in, right? So I don't know you from above, so, right?
Okay.
Now,
You met 5 minutes ago.
Alex, yeah, we literally,
Yeah, you met 5 minutes ago.
yeah, so we literally met 5 minutes ago or 10 minutes ago. And it's a long story, I know, but I'll just tell it, right? So when I have guests that I don't know personally, because I have had those guests in the past, right? What I do is, out of respect, I prepare like quite thoroughly. So I'll go and stalk them on LinkedIn and Google them and, do my research. Okay. But then I recently watched a podcast with Simon Sinek. You probably know him. Lots of people know him as an inspirational speaker, business leader, and all that types of things, right? And a podcast host. And he was interviewing a guest, and he said something very interesting, which sort of played on me. He said he hates listening to podcasts where the host is so prepared that the questions are like rehearsed and ready, and you don't get to actually find out about the real person that he's interviewing. So I said, you know what? Screw it. This episode, Yak linked up with you and has brought you on as a guest, which I'm grateful for. I said, screw it. I'm not going to prepare. I want to give Simon Sinek listener type of the experience that a Simon Sinek would want, right? So I said, I'm not going to prepare. But then half an hour before, my neuroticism kicked in. And I said, no, I can't go into this thing like fully unprepared.
You know there's people you can talk to, right?
I know. You'll give me some advice, maybe on camera or off camera. And I was like, no, I have to at least. So I said, let me check ChatGPT. I want to ask it about you, right? And here's an experiment that I did. So I made it do a deep search on you. And all I put in was, I said, I'll tell you exactly what I said. Let me read it out. So I say, and this, look, I'm scrolling a lot. I say, I'm preparing for my next interview. Tell me everything I need to know about Dr. Neeraj Mistry of the Fatty Liver Foundation. That's what I said, right? Then it asked me, it said, to make sure I get the most useful, blah, blah, blah. Do you want stuff on his professional background and all that? I said, just.
Oh, so it gave you prompts as well.
It gave me options. That's how clever this thing is getting, right?
Yeah.
So I said, just interesting things about his professional background, education, etc., which can give me an idea of how to interview him. Or for Why Did I Become a Doctor podcast. Then it gave me this whole thesis, right? And I'm scrolling. I don't want to read the whole thesis out because already I'm speaking a thesis out here as the intro. And I said, just give me a short, what did I say? I'll tell you exactly. I said, do me a brief intro, which covers the interesting things which I can read as the intro to my podcast, right? Now, this is going to be interesting for you to see what ChatGPT is.
Yeah.
I'm going to read it out verbatim, right?
This is not Google.
Actually, let me get Yak to read it out. Right?
Okay. Podcast intro. Today's guest is someone whose career spans continents, disciplines, and some of the biggest public health challenges of our time. Dr. Neeraj Mistry was born and raised in South Africa, trained as a doctor at Wits, and went on to work in both rural clinics and urban hospitals before pivoting into global health. He's held leadership roles in the fight against HIV, TB, and neglected tropical diseases, helped launch the world's first private fund for diseases like intestinal worm and river blindness, and advised governments, the UN, and the private sector on health strategies. Now, as Chief Medical Officer of the Fatty Liver Foundation in the US, he's leading the charge against one of the fastest growing yet most silent epidemics, fatty liver disease, using innovative screening methods and patient advocacy to change lives. He's also returned to South Africa, working at the University of Pretoria's Future Africa platform to solve big, complex problems through interdisciplinary research. This is a conversation about impact, purpose, and the many paths a medical degree can take you. And then it says, I'm so excited to share the journey of Dr. Neeraj Mistry. That's a part you don't put in your essay.
So did Mr. Chatterjee, which is what I affectionately call my chat GPT, did Mr. Chatterjee get it right?
I'd say about 95% right of what they did say.
Okay.
It's not the full picture, but I think it's a reasonable summary.
Okay. So the name of this podcast is Why Did I Become a Doctor, right? And what we do is we go all the way back to childhood. Like, growing up, what did you do? What was growing up like as a kid? How did Dr. Mystery
Back to
end
the
up
source,
as Dr. Mystery? Yes, back to source. Can you tell us about that? Where are you from? What was it like growing up?
Absolutely. Well, firstly, thanks for having me here. And kudos to you, Yash, for trusting your faithful cousin here. So I grew up in Durban, and very interesting upbringing because I grew up in an area of Durban that was not zoned according to the Group Areas Act. So the Group Areas Act meant that Indians, coloreds, blacks, and whites lived in different areas. But because this was in the CBD, the Central Business District of Durban, it wasn't zoned. And I grew up in an apartment building, flats. And it was at the heart of the city for people of color. So there were all the bus stops, there were taxi ranks, there was the train station, and the harbor was not too far away. And in the building itself were people of different ilks. So it was everything from Christian, Hindu, Muslim, etc., to then different races. And one of the interesting things is that Billy Naya and Sats Cooper and even Steve Biko for a short while lived in that building. So the exposure was just phenomenal. It was kind of like a kibbutz. We grew up running in and out of neighbors' houses. Every Sunday, I used to go with my neighbors to the church, come back and have a bacon and egg breakfast. During Ramadan, I would want to break fast and feast with my other neighbors. And so I would fast, and so then I could go break fast with them. And so it was just a very multicultural, diverse, integrated upbringing. And I think the word integration is important because very often when there's diversity, it's juxtaposition of different cultures as opposed to really different cultures interacting and integrating. And so that was a beautiful part of my upbringing. I couldn't have planned it. It was serendipitous, but hey, it turned out okay.
Just want to, you mentioned diversity. Diversity except white people, right?
So it was interesting because they did open some shops around, like liquor stores. And also my parents, who were in retail business, opened a store in La Lucia Mall back then. And in order for them to open a shop there, they had to get a white person as a nominee to sign the lease because a person of color couldn't sign the lease. And so they had to put someone on a retainer just to be the lease signatory. And so going to the store, to the shop over the weekends and hanging out in La Lucia at that time was just a lot of white people. And so it was all part of the enrichment of our experience and exposure to diversity. Yeah.
And are we talking about West Street in Durban? Is this CBD West Street?
No, this is Warwick Avenue, the Warwick Avenue
Junction.
Triangle.
Okay.
Right? And if you're driving into Durban, there's this highway coming off the entry.
Off the entry.
And that goes into Durban. And then there's a highway coming out. And between those two highways, the building, Himalaya House, that's the building I grew up in.
Wow, I actually know exactly what you're talking about. Right. But it's subsequently become very notorious that junction there, became Warwick Junction. But it was quite a upmarket at that stage, trading sort of facility with regards to spices and clothing and whatever else it is. But now it's a taxi rank, I think.
So there's taxi ranks. The taxi ranks were there before, but the fruit and vegetable market was close by.
Yeah.
The macheni, or the fish market, was also close by. And then the Durban Indian market, which was also the tourist market, where they used to sell spices. What was the famous one? Mother-in-law's Hellfire or something like that, right? So all the spices were there as well. So it was really it was just a hubbub of things happening. The notoriety of it was the fact that Warwick Avenue was the middle ground between warring gangs, right? And they were the TDKs, which were the terrible Dashin kids, and then the Victorians, which were from Victoria Street. And they would sort of have their little spats or big spats around the Warwick Avenue area. But it was residential, commercial, transit hub, retail, flea markets, everything in one.
So did you have any siblings or only kid or?
No, I have two siblings.
Yeah.
I have two sisters. I'm a middle child, but I'm an only son, so for whatever that's worth. It was quite interesting because my parents had 3 kids in 3 years, 2 in the first year. So I'm an Irish twin.
Sure.
My sister's in February, I'm in December. I mean, just to sort of add to the conversation on diversity, because we were so close, we were all 3 at university at the same time, and we all were up here in Joburg at Wits. But my older sister was in arts. She's a filmmaker, and then I was in medicine, and my younger sister was in commerce. And so dinner time discussions, and we all lived together with mum and dad as flatmates kind of while we were at university, was like the basis of any civilization is art. And I'd be, no, it's science. And my younger sister, no, it's commerce, you know, and so getting to the point of slamming doors and like, no, shut up, I can't talk to you anymore. As we are all quite idealistic in our fields when we're at university. But then my folks were like, well, it's all about the energy of the like environment. So they were quite spiritual and universal in their
So it sounds to me like you don't come from that stereotypical Indian family that we hear about where the parents say you must do medicine or law or engineering, or I mean, what were your folks and what did they encourage or discourage? Like professionally, occupationally, I mean.
So they gave us free rein to choose what we wanted. And I had applied for architecture, engineering, and medicine. I did drawing till matric, and I loved drawing. And then lo and behold, I got accepted for all, and I was fortunate because I also got scholarships for all. But I still hadn't decided what I wanted to do. And so chatted with mum and chatted with mum and dad and chatted with different people. And still couldn't quite figure it out. So mum said, okay, I'm done here. And she had a friend who was actually quite a prominent psychologist in Durban. And she said, you go speak to Devi and, you know, maybe she can help you. So being the astute psychologist she was, she said, well, let's do an aptitude test and see where your strength and forte lies. And so I did the test, and it came up strong on many different aspects, scientific, artistic, entrepreneurial, humanitarian, etc. And so I was like,
that doesn't help.
How does this help? Right? And then she said, well, let's flip it around and look at the professions which check most of these boxes. Right? And when you look at medicine, it actually has that range to appeal to those various attributes that an individual might have. And so that's how, on a very rational basis, I chose to do medicine. And I think it was the right choice. I really loved it, or love it. But I made that decision a week before medical school started. And then came up to Wits for that. Interestingly, when I do counsel students on who are thinking about medicine, you know, it is, so I draw on that a lot, that it has every field and faculty within medicine that you can think about. But it also is adaptable to personality types.
Okay.
So if you don't like people, you become a radiologist or pathologist.
Mm-hmm.
If you like people but you don't want to talk to them, you go become a surgeon. kind of thing, right?
Yeah.
So within the field, there's a lot that.
Wait, who are the doctors that like people?
It was interesting because one of my professors used to say, you take a donkey and you put it through medical school and you get a doctor. And essentially he was saying that the journey to become a doctor is conditioning to the extent that, it molds you to actually fit that particular role.
Yeah. Okay. So you carefully navigated that question and you haven't committed to a specialty that's people centric. But I'll let you off the hook unless you want to say something. But
I think it's, by nature, we as a species are gregarious, right?
Yeah.
It's that social engagement. That's I think the basis of life, right?
I agree.
But we have this little saying at home where everyone's on some sort of spectrum, right?
Yeah.
And it's a spectrum of engagement that we choose.
Yeah.
And within the medical field, if you really like people and want to hear their stories, you go into psychiatry.
Okay.
Right? And if you just want to get the gist of what people are going through, you go into general practice. 6 to 8 minutes per patient, and you crank it out, So I think within medicine, there's varying degrees of engagement.
Yeah. So we skipped a lot because what I like to do usually is find out how these doctors were in school, like high school, primary school, even high school. Were you one of these naughty kids, or because you're growing up in an area where there's potential for you to go anywhere, right? You can be in a gang, TDKs or whatever.
We don't know if he wasn't.
You might or might not have been in one. So what were you? One of these model students that just had your head in the books and your parents had to try and encourage you to do extracurriculars, or?
Yeah, well, first of all, to the viewers and listeners, Yash and I are sharing a mic because we had some technical difficulties. So you'll see us handing this over. But I just wanted to rule out first and foremostly, you were not part of any gang, neither the TDKs or the Victorians.
No, I wasn't part of any gang.
Yeah. Okay, that's cleared up. That's good.
Yeah, so tell us about,
Would it make it cool if I said I was arrested at that point?
Well, if it's the truth, yeah, you tell it how. But yeah, what was it like?
It was quite interesting. So I loved school, right? You got to hang out with your buddies, right? That was the best part of it, right? And I also found the schoolwork quite interesting, and had a natural flair for some of the subjects. So I really had a good time with it. But I don't know if you know Gandhi Desai.
No, I don't.
Have heard of it. Oh, you youngins.
Yeah.
So back in the day, Gandhi Desai was like the top Indian school in the country.
Okay.
And it was there by Greyville Racecourse. And it was nuts because Gandhi Desai was there, and it went from class 1 to matric, grade 1 to grade 12. Next to it was Orient High School, which was a Muslim Indian school.
OIS, I know that. Yeah.
Right?
Yeah.
Orient Islamic School.
Yeah.
That's right. On the other side was St. Augustine's, which was a colored school.
Okay.
And then there was a white boys' school on the other side. Then there was Girls High, which was an Indian girls' school. Then there was St. Anthony's, which was an Indian Christian primary school, and Hindu Tamil, which was a Tamil primary school, and Surat Hindu, which was a Gujarati primary school, Anjuman, which was a Muslim primary school, and Epsom Road, which was another colored school, etc., etc. It was nuts, right?
Yeah.
And when you look at parallel, duplicitous, and this was the fundamental principle of apartheid, which was separatist development.
Yeah.
And when you think about it, it's kind of nuts because the government hadn't mandated that we needed separatist development among the Indian community, right? Yeah. And yet it feels like it was a self-selection. But the whole premise of divide and conquer was, I think, what caused within the Indian community to go into their camps because it was a survival mechanism, right? And so it was easier to take care of your own community than to think in a more integrated way. And I think this is an important point that we'll get to. In South Africa, we still haven't crossed that threshold to think in a more inclusive, expansive, integrated way. We still very much think in our silos and individualistic as opposed to communal, which is, I think, one of the critical factors we have to deal with in a South African context.
Okay, yeah, that's super interesting. I'm glad you broke it down for the listeners and for me. It's an education for me also. So you ended up at Gandhi Desai then?
Yeah.
And so you were shooting out the marks were brilliant. Were you a sportsman or not really?
Yeah, I was swimming captain and sports captain and head boy.
Right. Okay. Yeah.
Maths Olympiad and debate and
Well, this explains the bursaries and all that stuff.
It was fun. I mean, I was lucky.
Okay, cool. Nah, don't be humble. I mean, you were not lucky. Well, maybe, why were you lucky? Why do you think you were lucky?
What's that lovely formula for meritocracy? Talent plus effort, right?
Okay.
So, school, however, high school and all of that didn't require much effort, but the effort needed to come after when one goes to university. Okay. Doesn't matter how smart you are in university, you have to put in the time, right? I was an all-rounder and I had a good time.
And you weren't hell-bent on the medicine. You made a very rational choice. You had your options. So it's not like you got into it for the doctor title or for the status and all that stuff. You'd gone to Devi. Who's Devi? What's her surname? She's still alive.
Yeah. Devi Rajat.
Yeah, she's a psychologist in Durban.
She's actually quite a prominent figure in the Indian community.
Okay, maybe we can get her on the show once eventually. So...
Well, set that bar high, guys.
So then you go to Wits, you mentioned.
Yes, I did go to Wits.
Why the hesitant response there?
Well, I wanted to get out of Durban.
Yeah.
I wanted to experience a different place.
Okay.
And I love Joburg.
Yeah. So you didn't apply to KZN and...
I did apply to KZN and UCT and all of that.
And you had options?
I had options. Joburg is a pan-African metropolis.
Yes.
Right?
Yes.
And you either like that or you don't.
I fully agree with you.
Did you know this before coming here?
I had come up to Wits for interviews and had visited before.
Okay, but you wouldn't have experienced being at Joburg.
The
way you're describing Joburg, you wouldn't have experienced it at that age, at 17, 18, right?
Yeah.
Yeah. So, okay, that's interesting. You had choices. And the folks didn't say to you, no, you stay in Natal University or whatever it's called. Okay, you go spread your wings. So you want to go to Wits. What are you thinking?
It's interesting. As a parent now, I have this feeling all the time when I look at my kids.
Yeah.
You're raising them to fly.
Yeah.
Right? And that's how my folks raised me.
Okay.
And Khalil Gibran has a lovely saying in The Prophet where he says, your kids are not yours, they're just born through you.
Mm-hmm.
And my mum was a huge fan of Khalil Gibran. And so I think that was part of her thinking. So fly, but always be tethered to home in some sort of way. Yeah. And no matter, over the past 25 years following an international career, Mum and I chatted every day.
Okay.
On the phone. Almost every day, yeah.
Okay, so what was the motivation behind going to Wits for you personally?
I just wanted to experience a different place, and I wanted greater diversity and exposure. And I felt that Natal was still quite restricted.
Okay, and you mentioned us being young, and so I feel comfortable aging you here by asking you, when was this exactly? When was your first year in medicine?
This was before the fall of apartheid.
Yeah. All right. You don't want to commit to a number.
This was 1989.
1989. Okay.
Yeah.
Sure. This is way before apartheid. Like 5 years. Before it ends. Before it ends. 5 years is a long time.
Yeah. Absolutely. And it was a really interesting time.
Yeah.
To be at university, and I'll give you one example related to medicine.
Yeah.
So when I had started at medical school, so after first year on main campus, you then go to med school. But there was a big issue because we had segregated hospitals, right?
Okay.
And students of color or non-white students were not allowed to go to so they were, allowed to go to white hospitals, but they were not allowed to go to OBGYN wards,
Okay.
obs and gynae wards in white hospitals. Yet white students could go to any wards in black hospitals.
Interesting. So what, they protected the dignity of the woman, or what was the thinking behind that?
Oh, it's anatomically different.
Oh my goodness.
Oh, wow.
No,
You just,
that's just doctor humor, right?
Okay.
Yes, it was about the sanctity of their women and like all of that.
Yeah, we're going to cut out that reaction. I'm joking. I'll leave it in because that joke flew over our heads. Like, we should have gotten that immediately. I'll leave it in just to show that we can be idiots also. Okay.
Gonna say something.
I'm gonna leave that in. Okay, yeah. I need to read your sense of humor better.
I do like the fact that you're a dentist and you second guessed your understanding of anatomy.
Yeah. Oh, brilliant. Okay, so but it was
different cavities, guys.
But it still makes no sense. Is my
speaking of which, do you know what vagina dentata is?
Yeah. Well, if there's, if there can
by
be
inference, I guess
teeth.
Yeah, absolutely. There's a whole mythology around that, but that's for another discussion.
Yeah,
there's also a movie.
That's right.
Okay, so I'll keep it in. The joke flew over our heads. It's embarrassing, but I'll leave it in. Okay, right. But it must have been what? It's just they're trying to protect the dignity of their woman, or what is it? I don't understand. Unless I
don't want to say dignity. I want to say
commas,
absolutely.
Dignity. You know what I mean?
Because
I'm not saying that by a person of color looking at a woman, you are making them undignified. I'm just saying that's what the government probably thought.
And this is all very relevant in this day and age where there is a distinct white supremacist agenda being pushed.
Okay.
Right? Not just by the US administration, the current US administration, but we're seeing the shift in other parts of Europe.
Okay.
We're seeing the rise in South Africa once again of that very conservative perspective on things. But the interesting thing that happened is the black students then said, hey, if we can't go to all wards in white hospitals, we're not going to let the white students come to any of our black hospitals.
Okay.
Right? Yeah. And so the white students also all of a sudden said, well, if we don't go to Hillbrow and Baragwanath, etc., we're not going to get a good exposure to a wide variety of cases, right? And so they stood in solidarity then with the black students to say, hey, we should just open all wards for all students kind of thing. So it was interesting how that happened. I also lived in my first year at university, I lived at Men's Hall of Residence. And traditionally what would happen at university residences is you would have a white students committee and you would have a black students committee. And this is to oversee the governance and running of the residence. The Black Students Committee was a sort of side thing, unofficial.
Yeah.
The White Students or House Committee used to be involved in the formal governance. And they used to vote, and it used to only be the white students that could vote, and hence vote their people in, and we couldn't vote. So what we suggested, and this was around 1990, we said, well, why don't we just have one election? Everyone can vote and like all of that. And the white students were actually quite comfortable with that because they were in the majority in the residence.
Oh.
Right? And so what we did is they had like about 3 or 4 candidates that they put forward. We chose to put in one. All right? And we all, as people of color, voted for that one person, whereas they
increase your odds, right?
Right? Yeah. We block voted, right? And their vote was distributed among the 4 or 5. And lo and behold, we got in our person of color in the residence. And it was an interesting shift. And all of a sudden, we became the first, not multiracial, but non-racial residents in the country. So really, really interesting times. And it's funny how things happen, because then you saw white guys who you would drink with all of a sudden say, hey, I'm out of here. And then you would see guys who you drank with and were like, okay, let's figure out how we do this together.
Wow, that is super interesting. Like most of the viewers, as far as I understand it, of this and listeners to this podcast are either students or potential students or past, qualified. So, this is interesting for me as a youngin, and I'm sure it's going to be an eye opener for a lot of the listeners and viewers, right? So you get to Wits, you get to the big smoke, Johannesburg. What's it like? Like what do you do that's different to Durban? How's university? Were you still a star student, or did it humble you like it does a lot of us star matriculants?
Oh, I failed dismally in my
Okay.
first year.
Okay, good. Yeah.
Right. And it was just, wouldn't say for academic reasons.
Yeah, because you had the aptitude to pass, right? Clearly.
But I was just so curious and hungry for so much more in life, dating and dancing and trying different foods and exploring different places. The live music scene in Joburg was amazing. Jamisons and Kippies and Tananas were big then, and Dr. Victor, Byron was coming up. So it was a really, really fun time in South Africa. Super hot sticks, etc. So there was just so much more to take on, and that's what I was interested in. It was interesting. You were talking about your career choice and how sort of you just followed a path that was laid out for you rather than really being reflective and thinking about it. What does an 18-year-old know about choosing and making life decisions?
Agreed.
And so I'm a huge advocate for a gap year, or I do like the American college system, which in your undergrad you can do a wide range of courses, and only after that you choose what you want to do. You can do art history and nuclear physics in your undergrad.
Agreed. Fully agreed. I wish I had a Devi in my life at that stage. I also, we had a guy that came and studied
Sounds
with
like
us.
a goddess, right? You might just find religion, yeah.
Yeah, if you just take that out of context, somebody will think that, yeah. We had a guy from America who came and did an elective here because he wanted to upskill himself on HIV and stuff. And he told us how their college system works. And you go to college to find yourself, and then you decide what you want to do. Whereas here in South Africa, we don't really get the luxury of being able to find ourselves. I mean, you got to go study and try and get a job, right? In most people's cases. So, it is a luxury here and a privilege to be able to do the gap year and find yourself and things like that, I think.
And a lot of that was about social mobility, right?
Yeah.
And particularly with the Indian community, there was the doctor, lawyer, engineer kind of thing, right?
Yeah.
Good, solid professions, high return on investment, etc. And get into it as fast as you can, get out of it as fast as you can, so you start earning, take care of the family, and get things secure. And I think we're in a fortunate situation now, not just as the Indian community, and I don't even know what that means anymore because we're all quite integrated now, but as South African community, where we don't have to crank it just for money. We can express and explore in ways of arts, culture, music, commerce, etc.
Yeah. And your family was living that in those days, because I mean, filmmaker, doctor, and what's the other one?
Commerce, marketing, MBA. Yeah.
Exactly. So it's quite unique for that time. I mean, now that's what I would think we'd aspire towards. Let your kids do what they want to do. And just look, I must make this clear. Like my old man said to me when I asked him what I should do. He said, "Go play cricket in the UK," because I was good at cricket. So I didn't come from that typical type of family either. But yeah, it's interesting to see how. So, look, you put it very well about your first year, and you were exploring and all sorts of things. But if I had to sum it up in one colloquial term, I would think you were catching a bit of a jolt in first year, or you were enjoying yourself, or how did you?
Oh, I was having a great time.
Yeah.
I mean, the last thing I was interested in was in my studies.
Yeah.
But sort of looking at the trajectory after that, the first 3 years of medicine sucked.
Yeah.
Right? Because it was a lot about rote learning and memorization, right?
Okay.
Very interesting stuff. But it just felt like you just needed to absorb stuff, right? Facts and data. The clinical years, I came into my own,
Oh, okay.
right? And I'm talking about like from the bottom 5% of the class to the like top.
Okay.
Because you started, when you would write a test in your preclinical years, you could almost picture your page or from your notes or a table, right? And you were writing that. In your clinical years, what would happen is you would picture a patient and you would see organ systems interact and engage and manifest with different things, signs and symptoms, etc. So it all started coming together. And I really enjoyed that, how you put it all together.
And with that dynamic of, separate races and all that stuff in those days, what was it like the actual experience of being, what were your lecturers like? Let me put it that way. Did they, did you have like white, black, Indian lecturers or just white? And was there favoritism? And did the white kids know all the questions that were going to come out in the exams? And did they get special treatment or how did it work?
I think it was a really good, solid education.
Yeah.
And I have to say, from primary school all the way through university, the ethic of teachers back then, our professors and lecturers at med school and everything, to our elementary school teachers, was just beautiful. They were so committed. And so that's the feeling I have when I walked out of or was at medical school, that people were really passionate about their subjects. And it didn't matter color or anything like that. They were doing it for the love of that particular discipline or subject. And that's how they responded. And if someone showed a flair or an aptitude towards something, they would push that person, irrespective of color. So I do feel like that was the academic environment that we had. Subsequently, I did work in academia. And then when you start seeing what's going on there, Henry Kissinger, who was the U.S. Secretary of State and a notable diplomat, he said he learned all of his politics in academia. So it can be a really toxic environment. But from a student point of view, it was wonderful.
One last question on that, not to labor the point, but I mean, you're one of the first people, like professionals that I've met, that started pre-94 and probably qualified just after 94. Am I correct?
Yeah.
When did you qualify?
95. Yeah.
95. So what was it like? I mean, 94, I mean, we were quite young, but I still do remember, what my parents are watching stuff on TV and things on the news and people being all worried. You were living away from home now at this stage. You were living here in Johannesburg, and then the apartheid government got disbanded. So what was it like then? Can you remember?
It was amazing. Oh, it was amazing. Just the energy, the buzz, the vibe. I remember the days specifically when I was walking on Jorrison Street in Braamfontein, and I got news that Mandela was released. And talking about the rest, that was when we were protesting as students, and you're standing in a group of 300-400 students, and you think, they can't arrest us, for there's too many of us. And they would come in with their Caspers and put us in buses and like all of that. I don't have a rap sheet. I don't have a record. So they did release us without, I didn't sort of get jailed or anything like that, just arrested and then released. But then you realize your vulnerability to the system. And so we were all very conscientized, politicized, aware of what was going on back then. And so we had skin in the game. It was our game kind of thing. And so I remember clearly that day, that feeling of elation, this cloak being lifted, this burden just like melting away. Even, we didn't even know the details of how this was going to work out, how we were going to get equity, etc. But just Mandela coming out was, amazing. It was a special time. And then I remember in 94, the first time we voted, we went as a whole bunch of students and friends, and just standing in line and different people of different walks of life, all, and we were in tears. I mean, it was just a really, really moving experience.
That's amazing. Any moments that stand out to you from university, from undergrad days, that stick out in your mind? I mean, I can think of one where the first day that I was going to see my first patient clinically in the ward for a subject called prosthodontics, which is basically dentures, false teeth. I'm so nervous because it's going to be the first time I'm going to lay my hands on a patient, right? So I'm stressing like crazy about this. I'm thinking about the procedure that I'm going to have to do for the first time ever, everything. And before I can set foot in the ward, the lecturer comes to me and he says to me, Mr. Naidu, here's a shaver, here's some shaving foam, go down the passage and go shave. I'll never forget that. So it threw me off completely for that first interaction that I was going to have with a patient. I'll never forget that. So do you have any moments like that, or even something good or bad or ugly, or not really, or you must have plenty?
Oh yeah,
Stands
yeah.
out.
There were lots of it. So I think once the clinical year started, you were constantly in the wards. So whether you were shadowing someone or having a ward round with the professor or consultant, so there was a gentleness to the patient exposure, right? Until you had to then examine the case yourself, and the nurses were always really, really kind to us. Our registrars would come and introduce us to a patient and say, hey, here's a student. They're going to ask you a lot of questions and examine you. So there was, the adage, see one, do one, teach one. And that was the culture. But I remember I think it was in fourth year when I was in OBGYN, and we had to catch babies, right? Deliver our babies. So I was at Alexandra Clinic, and so you had to observe a few, and then you had to be supervised to deliver the babies. And I remember the first one I watched, and the matron or the nurse was there, and they said, "Doctor, can we get you a chair? Are you all right?" And I just remember breaking out into the sweat, and like my ears turned like red, and I felt this heat and like
Brilliant.
pulsatile sort of dynamic throughout my body.
Yeah, I'm assuming it's because you had lack of OBGYN training because they kept you out in
and that's our first exposure in fourth year, right? In clinical, when we start our clinical years. But it's just like you hear about this and, childbirth, etc. And to see it the first time was just like, wow.
Yeah. So you knew obstetrics wasn't for you. Never going to be a thing.
No, after that it was quite all right. I mean, doing the first rectal examination or, like all of these things.
Okay.
And the professor was like, hey, you don't put your finger in it, you put your foot in it, kind of thing. Like it was such an important part of the clinical examination. And one of the things that was really, really drummed into us, 80% of your diagnosis comes from history.
Okay.
15% of it comes from special investigations, and 15% from your examination, and 5% from special investigations.
Okay.
All right. And so you were taught to be a clinician, to look and observe and then examine and palpate, and like it was putting all those pieces together. And now, practice is like, well, let me just run a battery of tests, see what comes up, and then go from there.
I find it fascinating, your experience of, because you mentioned just now that the nurses were also really great to you guys, right? And, previously you mentioned that the work ethic of all the lecturers and in your experience has been like, if you show your interest, they'll give you the attention that you need. Because a previous guest I've spoken with, who I think also studied a similar time, mentioned to me some really fascinating, or really a story that stuck out in my mind, where she mentioned that when she was a junior doctor, at one stage the interns who are white would question her ability, so they would double check what she did, even though she was senior. So it's quite it juxtaposes, your experience juxtaposes hers, and it's interesting. Maybe she was at KZN, so it might be slightly different there, but I just find it fascinating that your experience is like that. I don't want to, can we move on to past university now? What happens after?
Yeah, sure.
Or if you have any other interesting stories, please feel free. But yeah, what happens afterwards?
So I did my internship at Hillbrow Hospital.
Okay.
And I drove into Hillbrow on the 1st of January, 1996. And sort of driving between refrigerators and wardrobes and everything that were thrown from the tops of buildings, glass strewn all over.
That's a New Year's Eve tradition, this, Yak?
Yeah. It's nuts. And then there's a whole backlog from the night before. And just dive straight into it. And we were exposed to trauma and all of that as students. So that was my internship. I think it did mess with me. I think the level of responsibility one had to take without enough support structure. We were understaffed and everything. And
paid?
I think for the internship, it was something like 4,000 or 4,500 rand a month.
And that's, some people might think because it's 1996, that's probably a lot in 1996, but it's not, right?
No, it wasn't a lot.
This was before that OSD thing came in, occupation-specific dispensation or whatever, where the doctors fought for, decent salary, decent-ish.
Right, and I was a doctor in training, so I wasn't a fully fledged, medical officer or senior house officer or anything like that. So, but what was fun for me is I used to moonlight in private in theatre, so at Brenthurst Park Lane, with some prominent surgeons in the South African.
Was this even allowed? It's fine, it's done.
Well, I think there might be a moratorium on any of my misdoings at the time.
That's okay.
But no, so not during my office hours. So this was on my own time that I used to do that, and I was sort of assisting rather than doing anything on my own. But it exposed me to a whole other world of private medicine and all of that. And back then, the interesting thing is a lot of the doctors in private were also in the state hospitals, and they would rotate. They would run clinics in private and run clinics in the public sector. Yeah. And we wanted that because you kept up with a really solid academic standard, because your time in state was usually university-affiliated hospitals. Joburg, Jane, Hillbrow, etc. And so people would sort of do the dual track. I mean, even to the extent that if someone you were seeing in private ran out of medical aid or health insurance, you would tell them, "Come see me in the state hospital," kind of thing. So it was actually working. We were making the best of it. Trying to maintain academic standards, provide as much coverage as we can and access to services, be efficient. So it was good. And then I finished my internship, and
that's 2 years, right?
It was 1 year.
Okay, at that time.
At that time, and I think it was 2 years after I finished that they introduced National Community Service.
Oh, okay. So you didn't have to do ComServe at all?
I didn't have to do it, but a couple of mates of mine, we liked the bush, so we went and worked in the bush.
Yeah. Tell us more.
And it is interesting how much service you can provide in general practice out in rural areas.
Okay.
And even when, we had mobile units, you would go and out in the middle of nowhere, this kid with a rash or a snotty nose comes running to you and he pulls out a medical aid card.
Yeah.
Right? Because his father is a mine worker or working in the city that's covered with insurance that covers the family as well.
Yeah.
So there were ways of providing services all out there. So in Mpumalanga, and then I also did some locums on the mines in occupational health and safety. That was in Rustenburg in Platinum, and then East Rand proprietary mines. And it was interesting then because the government had introduced red tickets.
Okay.
And red tickets were mini x-rays of the chest, audiometry, visual assessments, and just a general physical to assess for disability,
Okay.
and then make claims for workman's compensation. So there was a backlog from apartheid days
Sure.
that the government was then catching up on.
Okay, but hold on. So after internship, you go straight into private practice. You go to where do you go to? What do you do?
So I started just locuming in different places.
In Mpumalanga?
In Mpumalanga, Rustenburg, down in Cape Town.
Oh, so you're all over the place.
Yeah.
But you fly and travel, or you drive everywhere?
Yeah.
That sounds chaotic. I mean, is it?
Oh, it was fun.
Yeah.
Yeah.
You loved it.
You're single, footloose, fancy free.
Yeah.
You experiencing different patient cohorts, you seeing the country,
fascinating.
and then different disease profiles.
Was it like part of a group of private practices? How would you find these?
So you would find there would be a lot of practices that would advertise locum positions, and then you would apply for it, and yeah. And then you start getting known on the circuits and like all of that.
Yeah.
And then the government was also looking, so they couldn't employ doctors fully, but they needed to catch up with the backlog of red tickets. So then they just started hiring doctors as locums.
Yeah. So I might be jumping ahead here, ahead of Yash's schedule. But is that where you found your love and desire for community medicine? We previously had this discussion because I didn't know what you do. I mean, I knew that you were a doctor, but I knew that you were not treating patients.
Hold on. No, before you answer that, how do you two know each other? Can I ask that question?
Yeah, you can. So Neeraj is, well, consider him as a friend now, but he was referred to me as a patient. I think I did was it a wisdom tooth that I had to remove once?
Yeah.
Is Yak inadvertently breaking doctor-patient confidentiality here, or are you comfortable?
No, I see one of his colleagues now.
Expand that relationship.
Okay, so all
We've
right.
transitioned here.
Yeah. Okay. All right. Okay. No. Carry on, Yak.
Yeah. So do you think that's where the love of community medicine came in?
So and we'll go into what the medical journey became afterwards. It wasn't quite a community medicine specialization, but I am all about primary healthcare and rural access. And, there's a lovely term in economics concept called Pareto optimality, which essentially says that your greatest gains are made when you start off with those that are worst off first, because no one else loses. In economics, we talk about opportunity costs. When you do this for this person, this other person is missing out. But when you start off with those that are poorest, then you're not actually taking away from anyone.
Yeah.
Right? Because it is, for an incremental investment, a huge return. And those are the rural communities we need to deal with, peri-urban settlements, uninsured people, primary, secondary, tertiary level prevention, all of those sorts of things. And so that's where my heart is, right? I do like advanced medical advances and like the technology stuff, but yeah, that's the sort of area I like most. And then there was a lot of infectious diseases in those contexts, neglected tropical diseases. But I think the other thing that's really important is that a lot of the conditions we deal with in rural areas are amenable to social determinants of health. So more often it's not a medical intervention, but a social infrastructural investment that we need to do in order to address that. Interestingly, about community service, and doctors did feel singled out. So we would treat food and waterborne diseases, and then people would go back and come back with the disease again, etc. And we were like, where's the plumbers bringing water sanitation to these communities? Where's the electrification so people don't have to burn fires in their houses, which is giving them respiratory infections or conditions? And so we felt that this was something that needed to be expanded to other disciplines, not just doctors, in order to be more sustainable and not excuse the pun, put a Band-Aid on a gaping wound, right? But how do we shift that whole infrastructural thing?
Yeah. So take us on that journey. I mean, you were done with locuming around the country and private sector. How did you get into? I mean, because Chatterjee said a whole host of things about you being in America, and you're quite formidable with primary healthcare. So what's that journey like? You gave up.
Oh, you're missing out the most titillating part of my one of my practices in South Africa.
Yeah.
Tell us.
As I was exploring locums, I did get a locum in at one of the clinics in South Africa, and then went on to become a full-time employee and then the medical director. And this was the men's clinic, dealing with male sexual dysfunction. And this was pre-Viagra. So we were using injectables of vasodilators. And as you probably know, there is significant pathology, and erectile dysfunction is an early sign of maybe some underlying cardiovascular issue. But a vast majority of men, it's more psychological or performance anxiety related, right? But that, interestingly, and it was great because it was well-paying job. So, that was like, this is what it is like, to sort of get to a different level of income. But that's where I learned all my bedside manner. Okay. Because none so fragile as the male ego when it comes to his sexual performance. I mean, we're talking medically here. We expect women to lie in the lithotomy position and do a pap smear, and that's just what we do. But all of a sudden, when you're dealing with male sexual dysfunction, it's a whole other level. So it was a really, really interesting time, and I can't say it's something that, so a lot of my colleagues would have a chuckle kind of thing. And then they'd hear about how much I was earning. It's like, oh, no, I want to get a job like that. I'm like, you think you could? Yeah. And they would think about it and like, no, I'm not sure. Yeah. But that's what my my journey in medicine was. It was an exploration. I was just always curious, and one of my advice to young doctors or even to students is, hey, if you're curious about something, or if you have an itch, go scratch it. What's the point of having the itch if you can't scratch it? And so the moment something tickles your fancy, go out and do it.
But how did you? It seems like a bit of a pivot if you're going around the country and then you end up at the men's clinic. How did that happen?
That was in Sandton, and so I was like, okay, let me try that out for a while.
Okay, you've answered my next question, because it was going to be, this is probably in an upmarket area.
Right? Yeah, it was. And now, I mean, there's clinics all over the country, and then I started training doctors. And what was also really interesting, so then I started sort of going into not just clinical practice, but health management, or management of health and health administration, as well as capacity building and training, figuring out processes and all of that. So it just exposed me to a whole lot more. But then clinics also started opening in Botswana and Zimbabwe, Mozambique. So it's quite widespread. And it was started off by a group of doctors in Australia. Okay. And so there was a bit of international collaboration. So that was quite interesting. But then at some point, I did explore being a ship's doctor on the Symphony.
Okay.
Right.
Yeah, he's been on the Symphony.
Right. And that's a party boat, right? Yeah. And as the ship's doctor, you sit at the captain's table and and it feels like it's like a pilgrimage that every South African doctor does to go to the UK. Yeah. But I did go to the UK, and instead of going being the ship's doctor. Yeah. But it was also a curiosity to see what was medicine like in first world countries, right? And I got to work in the good old NHS, but I also drew on my sexual health experience and worked on Harley Street, which is kind of like Park Avenue medicine, right? And to see me was like £450 an hour.
Wow.
And this was way back when, right? Yeah. And it was obviously the clinic fees. But so I worked in public and private, in general practice, and then also very specialized. But something happened then where you like to think that what you're doing as a care provider, whether physician or dentist, etc., is evidence-based, based on the latest and greatest evidence. But when you start digging deeper, those decisions aren't necessarily evidence-driven. I'm not saying there isn't evidence, but I'm saying it's not the best evidence, and there's other influences on that. And this is where in health we have quality, safety, and efficacy of interventions. But the fourth hurdle is cost effectiveness, right? And so I got really curious about that. Why is certain drugs on the formulary and certain aren't? Why are we approved to do these interventions and not? And that's when I went to the London School of Economics and pursued an economics degree with a specialization in health policy and health economics.
Hold on. So you stopped practicing for a while?
No, I was still practicing, and I was
in the
studying
UK and then studying
in the UK.
there.
Yeah. And so I do like weekend calls and go to Bath or go to like Dorset or Edinburgh and be there for 48 hours on call, and then come back and hit the books. And
so how many years was this in the UK?
UK was about 2 years.
Yeah.
And the master's at LSE was a year.
All right.
And London School of Economics was just bloody brilliant.
Really?
Oh, man. It was, what an environment.
Yeah.
And there's the Oxbridges,
yeah,
right? But LSE is just in the class of its own.
Okay. And then what makes you come back to good old Mzansi? Or are you...
Oh, no. And then from...
come back.
No, from London, I landed a gig with Merck. You got to get into the belly of the beast, Big Pharma.
Yeah.
And so I went to New Jersey, to their headquarters in White House Station. And so this is around 2001. And it was an interesting time in medicine, right? We call this the heyday of global health and development, international development. So I was in external affairs for Europe, Middle East, and Africa at Merck. Everyone has the perception that big pharma are evil, profiteering companies. Pharmaceutical companies, big pharma, are big. They're huge, and they're not a homogeneous entity. So when you speak to someone in community relations or research and development or marketing or business strategy, they are all very, very different. And it's almost like having community engagement is kind of like an NGO within a pharma. Marketing is like an advertising company. And this is where the executive office with the CEO, that's where the big brains are, because they put it all together. But it depends on which part of the company you're talking with, and you get a very different perspective of them. So it was really, really interesting. But it was around the time where we were kind of hitting our peak of the AIDS epidemic, right, globally. So I went to Merck to actually do a study for them on health targets and how important it is, or what the impact of targets are. And that's a whole other conversation. But as I was then looking at what my next move was, I was speaking with my boss at Merck, and he's also a phenomenal character in global health and development. And I said, so now I'm a doctor, and I have an economics degree as well, and I've worked in the global south, and I've worked in the global north, in the public and private sector. What do you think I should do next, right? And so he looks at me and he says, well, what are you interested in? So I said, well, AIDS is very close to me, right? Growing up in South Africa, seeing AIDS patients, and we didn't have antiretrovirals at the time, right? Do I think it's the most important issue in the world? No. But I think it's the most important politicized springboard issue that can help raise awareness to a whole lot of other things, right? And then I said, and I don't believe that any single sector can actually take on a global challenge like HIV on its own. Not government, not business, not NGOs, but we have to work in partnership, right? This is the middle child in me coming out, right? And so he said, I know this guy who's been asked to set this thing up. Let me put you in touch. And it so happened that Richard Holbrooke, I'm going to drop some names here, was the former US ambassador to the United Nations, right? And he, very interestingly, sharp guy, he took HIV not to the UN Health Council or anything. He took HIV to the Security Council. And he said HIV is a security risk because if HIV infects your army and your armed forces and decimates it, you are vulnerable, right? And that's how he raised the profile. And so you can start to see the sort of multidisciplinary, interdisciplinary stuff setting in for me. And so when Richard finished his tenure at the UN, Kofi Annan, who was the Secretary General at the time, asked him to set up a platform on business engagement in HIV, right? And so he set up the Global Business Coalition on HIV/AIDS. And he then had someone seconded from UNAIDS to that. And so Ben, who was seconded, needed to set up a team. And so Richard says, well, how can we be an AIDS organization without a doctor, and especially a doctor from South Africa? So it's just by chance I stumbled across it. And then there were 4 of us that set this up. And what we did is we worked with multinational companies to get them involved in HIV. And I'll give you a couple of examples. So Big Pharma, for obvious reasons, they were manufacturing drugs for HIV as well as opportunistic infections and everything. But in order for doctors and drugs to work, you need logistics, distribution, management support, all of that, right? The biggest distributor of anti-malarials across East Africa is DHL and FedEx, right? So those are the types of things that allow service delivery and access. And so we started working with all these different companies. I remember sitting with MTV and Viacom, and I'm like, I'm a doctor. I can take care of the physical body, but you guys get into the hearts and minds of people, right? And when you talk about HIV, it's all about behavior change, right? No one wants to listen to a doctor in a white coat.
This group of the 4 of you that are doing all of this, what do you call yourselves, or what is it called? That actual group?
It was called the Global Business Coalition on HIV/AIDS.
Okay, and then you're meeting with MTV, you're figuring out how to distribute things, you're figuring out how to make, get into the hearts and minds of people, young people. Carry on. I just wanted to just check what the name of that entity was.
Oh, yeah. And it was nice because we were meeting with these companies at principal level. So like CEOs and EVPs, executive vice presidents. But there was also a lot of media and marketing companies, fast-moving consumer goods, the Unilevers and Procter and Gamble's of the world. The big one was the mining and engineering companies. At one point, Anglo American was hiring 2 workers for the same miners for the same job, on the premise that one would get sick from HIV, and they did. So it became a business interest for them to respond to HIV. So the 4 categories of engagement was their workforce, right? So those companies that had operations in hard-hit regions across Africa, Asia, Latin America. Then it was their core competencies, things like logistics, distribution, etc. Then it was advocacy and communications.
Okay.
That was really, really big. Because when Tony Fauci stands up and talks about HIV, here's congressmen and senators and everything. Yeah, sure, he'll talk about that. But you bring in a business leader who's the CEO of a company like Richard Branson or Jürgen Schremp, who was the head of Daimler, etc. and they say HIV is important. Okay, tell me more.
People listen, yeah.
People listen, right? So it was
And celebrities, I guess, also people listen to celebrities.
well, you know PEPFAR, right?
Yeah.
PEPFAR, the President's Emergency Plan on AIDS Relief that was announced by George Bush. And
The thing that Trump just recently chopped and then it came back.
Yeah, absolutely. But Bono was a huge factor in getting that passed, and we were quite enamored when we took CEOs of companies to the Hill, and how the congressmen and senators and appropriators paid attention to them.
Were you involved in that Product Red thing?
Yes.
Because like Apple is big on Product Red.
So I was just cleaning out my wardrobe, and the original red T-shirt from Gap, which was the first product, I still have it.
I'm getting goosebumps.
Yeah. What is Product Red?
I'll tell you how I know about Product Red.
Yeah.
I'm an Apple fanboy. I'm a recovering Apple fanboy, right? I'm no longer a fanboy. But every now and then Apple would release a special iPhone which is red, and it would be called a Product Red iPhone edition, whatever. And then I would always see this sign which is 2 brackets or parentheses, and it says red. And then at the bottom it says proceeds from this will go towards the fight against HIV and all that.
So this actually started at Davos, and there was a side meeting, and Giorgio Armani were there, and Bono, and Converse, and a few other companies, and they committed to saying, well, we'll use our brand to help raise awareness and raise funds for HIV. So that's how they came up with Product Red, that they would dedicate a particular line, and Gap was the first to come up with the red T-shirt. But there was Converse, and there was iPhones, etc. And then the proceeds of that would go toward the Global Fund to fight AIDS, TB, malaria. It was interesting, MAC Cosmetics, right? They had a line called Viva Glam. They didn't do any advertising for Viva Glam besides the fact that Viva Glam was a dedicated line where all the proceeds went to the MAC AIDS Fund, which then went to support AIDS programs. And it was their bestseller.
Wow.
And, RuPaul to Pamela Anderson and everything were ambassadors for this. So it was so interesting at the time working with all these different companies.
And if I can get it correct, my interpretation of this is your role was basically like a translator to get the information of what HIV and any of these epidemics at that stage was, to translate it to someone like Bono to be made aware of why it would affect his populace of support.
Oh, yeah. So my challenge to my teams were, you give me any company anywhere in the world, from any industry, and I will find a way of making HIV relevant to them. Right. And it was a really, really creative process. I mean, one of the big things, so you saw that Trump had restricted imports or put tariffs on the imports from Lesotho, right?
50%.
Why Lesotho?
Yeah.
Right. And what had happened is the United States had put quotas on imports from China, and all branded lines like Levi and Gap and Banana Republic, etc., are manufactured by Chinese companies and then imported to the US, right? By these brands. Now, because the US government put quotas on China, Chinese exports, Chinese companies relocated to Lesotho, right? And then their exports were technically from Lesotho, yet it was the same Chinese company. So we started working with these companies to look at how they can protect their workforces, and then also get involved through things like Product Red. It was interesting because, from working with the mining guys where they had policies like total sustainable mining, and I went to Alberta, Canada, where there's the annual mining conference and the whole world congregates on that, to like the multi-fiber agreement forum that the clothing and apparel industry has, etc. So it was just like, for, my ADHD tendencies, it was just like, this was like candy for me, like
exposed to everything.
Everything. And what happens is the more you're exposed to, the more building blocks you have to creatively put things together in a different way. right? And so it just became a lot of fun for me in order to, in advising these companies, but found it very stimulating.
I mean, you've mentioned the term creative quite a few times. I mean, are you a creative at heart, or?
Oh,
yeah,
I'd like to think so.
Yeah. Okay, that's so cool. But then clearly, even that you got tired of doing because you obviously moved on to something else, right?
So the interesting thing about that is when you speak to, so when you're mobilizing a business sector response to a public health issue, you have to do this reciprocal mobilization of international NGOs, UN agencies, and governments to say, hey, these guys are here as a partner, and here's what they can contribute, right? And so from speaking to oil and gas, to marketing, to consumer goods, and then speaking to UN agencies, and then speaking to a medical institute, and then speaking to government, you had to translate complex scientific information for different audiences, and you had to speak in a way that everyone understood.
Yes.
So when you use a term like cost, right? Cost means so many things to different people, right? And so you had to find a way to speak, that was accessible and easy to understand.
Yeah.
And lo and behold, I had an inclination to that, right?
Okay.
I could do that. And that's what then led me to Washington, D.C.
Yeah.
Because when you speak the language of Joe Public, that's the language that senators and congressmen speak.
Okay.
Right? And so when you start doing advocacy with governments, you have to be able to take information and say, here's why this is important, here's what the data says, and here's why you should invest in this kind of thing.
So what was your title actually at that stage? Did you even have a title, or you just?
So I then joined strategic communications company in Washington, D.C. And these companies can spin anything.
Okay, yeah.
Right?
Stratcom. They call them Stratcom.
They call them Stratcom, also known as lobbying firms.
It's a derogatory term, right? Stratcom.
Yeah. It's a euphemism for what they really do. And there's some companies, that created the communication strategy for the tobacco companies.
Yes.
Like those sorts of things. So there are some sinister things, and it's responding to the needs of the client. But when you think about it, and this is interesting to put out to you guys, especially us sitting here on a podcast, is, well, you take the professor at some hospital affiliated to university, right, who's an expert in his field.
Yeah.
And you think about the impact he's having. You think about the impact then that Sanjay Gupta is having.
Yeah.
Right? Sanjay Gupta is reaching more audiences with messages in which they can understand and change their behavior.
Yeah.
Right?
He's the CNN guy, right?
Right. He's the CNN doctor, right? And so...
Because the term Gupta in South Africa, I just want to make it clear to viewers and listeners. Yeah. It's
they're a dime a dozen kind of thing, right?
Sanjay Gupta is a medical doctor.
Yeah, Dr. Sanjay Gupta. So he's the CNN medical correspondent.
Yes.
But the fact that he has such a captive audience around the world, and he's distilling a study or saying what the implications are and what the impact on you is, etc., and how you can actually change your life based on the study, that has much greater impact than an advanced researcher.
Yeah.
And so that's what sort of also got me interested in strategic communications. How can you use that pulpit or that platform to actually have that impact?
We need to get him in touch with Elton, because that's right up Elton's alley. If you're watching this now, he'll be the previous guest on this podcast.
Oh, the guy
that you just met, right? And it's, his goal is to try and maximize somebody's potential. Now, you mentioned, the professor that's a brilliant mind that has a very limited reach because he or she is just touching those people that they educate. Whereas Gupta has got that global audience, and he's got a platform, and he can change not just some people's lives, but change a lot of people's lives.
Right.
So that's what Stratcom allows you to do also, right?
Absolutely.
Okay. So what happens? You get into DC, and then what's next? Or Yak has something to ask.
Yeah, I'm interested now in the personal aspect of, we're talking about medicine and everything there. So we want to also bore the audience. A lot of people that you know are going to be watching this. So how did
This
you?
is super interesting, by the way. So
I'm just saying we just diversified a bit.
okay.
So who is Alison first of all, and then how did you meet her?
Wow, go right there, Zach.
Was there an Alison that was mentioned?
No.
I've been paying attention this whole time. I never heard Alison. Go for it.
Well, he'll explain who Alison.
So it was interesting because I was single, footloose, fancy free, traveling voraciously. When I lived in New York, I traveled 80% of the time and all over the world. So that was a lot of fun. But dated widely, had a really good time with it. I didn't think.
Did you say widely or whitely?
Widely.
Okay.
Yeah. Absolutely.
This is white, by the way.
We're an equal opportunities engager here. So I didn't, and living in New York City, like there's no incentive to settle down. It's just, and it's interesting when you're in New York because like when you're going out for dinner with friends and you're walking around and you haven't made a reservation, you like walk down the street and like, I know this restaurant here. And someone says, around the corner, there's this other restaurant that's better. And like it keeps going like that. That's exactly how dating in New York City is like there's always something better around the corner. There's no incentive to settle down. So it was a shift in context from that New York environment when I moved down to DC. And I always thought I was going to go back to New York, that Alison and I were introduced by a mutual friend. And so for my career story, it's like I moved to DC, get involved in Stratcom. This is at the 2008 recession that hit. And so everything's disrupted. And then boy meets girl. And we just had a great time.
You guys have a similar sort of academic background, if I'm.
Yeah. So she's a science policy analyst, and she's quite something in her field. She's also nice to look at. That always helps, right? But it was interesting because. And people go out, they date, and they enjoy, but and there's always this quest of like the one, right? And so one, there's not always just a one. There's many, right? Okay. That one could potentially settle down with. But I think what happens is people don't pay attention to a shift that happens when there's a potential one, right? Intrinsically, but also in your engagement, in your expression of that intrinsic shift that happens. And so what was interesting is I'd finish work and I'd call Alison up and I'd like, hey, what you doing tonight? And she's like, oh, I haven't planned anything. I'm like, maybe we get dinner. And so we'd meet at like a Trader Joe's and we'd buy a few things. It's a grocery store and then go back to her place or my place and cook up this meal and have a nice glass of wine and just hang, right? And that comfort of not needing to be on a date, which is kind of performative, was a shift that happened for me. And that was really, really interesting, that ease and that comfort with which it happened. So that was quite nice. And then professionally, what happened at the time, I know that Yak wants to dig deeper into all of that, but professionally, what happened at the time was there was the Global Network for Neglected Tropical Diseases that was looking for a director, and I applied for that. And it was near and dear to me. And, people are like, what's an NTD? And right? And so let me ask you this. How many people do you think in the world are living with HIV? Out of 6 billion people on this planet, how many do you think are living with HIV, diagnosed or undiagnosed? Our estimate.
Very close on to 3-4%.
3-4% of 6 billion, right?
My math's not.
Give a number, Yak.
So
I would say
10% would be 600 million. Divided by 3 would be 200 million.
that sounds high now that you said a number.
If that's the math, that's the math. I'll agree with it. But
So our estimates are anywhere between 36 to 40 million people of the 6 billion people on this planet are living with HIV, right? And you walk out on the street now and you ask anyone what is HIV, and you do this in Mumbai or New York, and people will know what it is.
Yes.
Right. How many people do you think are living with a neglected tropical disease?
Look, I'm guessing it's going to be much bigger figure than 40 million.
I don't even know. What is a neglected tropical disease? I'm talking about malaria. I don't think it's being neglected at the moment. They give us shots for it every time we go across the border to Mos.
Tell us the number.
So it's about 1.5 billion people.
Sheesh.
Right.
160.
About 1.2 billion people, right?
Yeah.
So it's 1 in 6 people on the planet, right? Did any of you have a neglected tropical disease?
Probably. I don't know.
I doubt it.
So
COVID count.
I remember growing up as a kid and you guys playing or playing in the dirt and everything with your friends. And then all of a sudden you're craving sweets and you got an itchy bottom and you maybe break out in, worms, right? So intestinal worms are one of the commonest, right?
Okay.
And then what would happen is all the mums would get together and give all the kids deworming worm marks, right? So that's a neglected tropical disease, easily treatable. But when you don't have the treatment or you live out in the sticks, right, it is debilitating, right? And you take Woolworth's food and you give it to this kid, and there was actually a study that showed the caloric rob that the worms do for the food that's given to these kids, right? So firstly, they're undernourished. Then even if they get good nourishment, the worms are eating the food, cognitive decline, school absenteeism. So everything is affected by that. But also bilharzia or schistosomiasis, trachoma, onchocerciasis, river blindness, lymphatic filariasis or elephantiasis. All of these are neglected tropical diseases, right? There's 17 according to the WHO, and even snake bite is included in it. There's been a push to have pediatric HIV as an NTD. But this affects the poorest people in the world, right? And so this is close to my heart, as we were talking about. And so when this opportunity arose, I'm like, yes, this is where I need to get involved. And it's interesting because we have treatments for most of these NTDs, and the global response to NTDs is actually built on the backs of pharmaceutical donations.
Okay.
Right, albendazole, mebendazole, azithromycin, DEC salts, etc., that are used to treat all of this. So once again, it was like public-private partnership stuff, and then a lot of advocacy. So working with the Bundestag, which is the parliament in Germany, to the Norwegians and the Dutch and the Belgians, but then also Nigeria, India, all of that. India was fascinating to work in.
So did you travel there? And,
plenty of times. Yeah. With some Bollywood stars too.
Yeah.
Oh, wow.
Can't you drop some names?
It was really interesting because
so it didn't happen. Yeah.
With India, it is probably one of the largest public health programs in the world. They call it filaria, filariasis, right?
Yeah.
They do about 450 million treatments a year, like accessing 450 million people.
Yeah.
That's huge. Like the scale by which they operate is just something else. But we went to one program with this community-based organization, and so everything was working well. They were getting treatment, they were getting sanitation, they were reducing morbidity from those who had it, they were preventing infections in people who didn't have it, etc. And so it all worked very well. And then we were sitting down and we were having lunch. There's all these women in saris and we're under this tarp, and it was in Orissa state. Which is very beautiful, and I was really impressed socially and culturally when I engaged there. And so I'm sitting there, and so here I'm brown, right? And I'm this hotshot doctor from Washington, D.C.,
Yeah.
and I'm bringing money to the program and supplies and everything.
With a South African accent.
Well, yeah, and I'm talking through a translator,
Yeah.
and they can I can understand them.
Yeah.
Like my Hindi and
really?
Gujarati understanding is rudimentary, but I can
that's
sort
good.
of get by. And so at some point I said, okay, you're happy with everything? And they were like, happy, all that. And then I said, now I need something from you. And so all these women in saris, well, gender, I'm a male,
Yeah.
right? And then like this doctor from DC and like everything. And they're like, what on earth could this guy want from us?
Yeah.
And then I said, how many of you are mothers or parents? And they all raised their hands, right? And I said, well, I'm freaked out because I have 2 kids and we're pregnant with our 3rd. And I'm like, I don't know how we're going to manage, right? And I showed and opened my vulnerability, right? And the conversation all of a sudden shifted. And they were like, well, your first 2 kids, and like 2 girls. And they're like, oh, you're going to have a son now. I'm like, I could do with 17 daughters. But hey, if you bless me, lo and behold, I got a son and everything. But when the conversation changed, I then realized there was a sadness about these women, right? And so we probed a bit into this. And while the program was working really successfully, the reason why they were sad is there was a social stigma that because these women, mothers, had elephantiasis and infectious diseases, their daughters would get it.
Oh.
And many of them had daughters of marriageable age and were not able to get their daughters married. And it was such an important life goal to get their daughters married.
So did they open up to you after you'd shown your vulnerability?
Exactly.
This is how you...
Right. And I use this as a really important, not use it in a manipulative way, but in order to connect with people, you have to show your vulnerability.
Do they train you on this in Stratcom circles, or is this just you? You know how to...
I guess it was my journey as it unfolded, right? And so I'm like, shit, are we really doing success in this program if ultimately they can't meet their life fulfillment goals, right? We're taking care of health in a very superficial way, right? So what do? I call my contacts in New York and DC, and we figure out how to get to a Bollywood star, right? And I get to Abhishek Bachchan.
Right, wow.
Right?
Even I know that person.
Right?
Yeah.
Because
I don't know
I couldn't quite get to the big B, right? The big Bachchan.
Yeah, that's Amitabh, right?
Right, Amitabh. And so we then have a meeting at Amitabh's house, and Abhishek and Aishwarya live at the house.
Okay, Aishwarya Rai, yeah.
Right.
His son and daughter-in-law.
Right. And so I go to the house, right?
Yeah.
And so we get the meeting and everything, and then sort out all the logistics, figure out the program, and then we fly on a jet from Mumbai to Orissa, right? Bhubaneswar, on a private jet with Abhishek, right? Really nice guy, right? Very down to earth and all of that. And we get on film and pictures of him washing the feet of someone with lymphatic filariasis.
Okay.
He's down on the floor, this woman sitting on a stool, and he's helping to pour the water and wash the feet in order to break the stigma that was around this, right? And so that
Who came up with that
sociological
idea?
intervention.
Was that you also?
Well, me and the team, sorry.
No.
We like figured out how do we tackle the issue of stigma in this, the success of the polio program in India to a large extent is with Amitabh, where it's the peace sign, but it's representing 2 drops, and it's the 2 polio drops.
Wow.
And so we launched then a program called Hati Pav Mukh Bharat, which is filariasis-free India. Hati Pav is elephant foot, right? Elephantiasis. So that was just like, it was
story,
surreal.
Yeah. Sure. It would either have to be a Bollywood star or a cricketer, right? That would have been next on the list.
Ajay Jadeja.
Yeah.
He got involved.
He's a Sri Lankan, I think, or not? Right?
No, he's Indian.
He's Indian.
Yeah, from the south, right?
Okay.
So there were some cricket players. Although we should get a kabaddi guy.
Yeah.
Do you know kabaddi?
No.
Oh my God.
What's that?
Dude.
What's that? Yak, you know.
I don't know. I want to guess, but no.
Yeah.
Not.
So kabaddi is probably one of the biggest sports in India.
Mm-hmm.
And it is kind of like handball and touch rugby all in one.
Okay.
Right?
In KBHT, does he play that? No.
He plays ultimate frisbee. Yeah. No, we don't know.
It's like a thing. Like you throw it and another guy catches it.
Yeah. So, and when we were in primary school, we used to play a game called Hupu. I don't know if you know Hupu, right? But it's an exaltation. You shout Hupu when you cross a certain line and everything like that.
Okay.
And kabaddi is a game that and it's also a touch to get out and like all of that, right? And I think Hupu actually derived from that. But there's like leagues and everything in India and teams and like all of that. But the coolest thing, well, I mean, from a lot of Indian women that I've spoken to, is the kabaddi guys are like built Indian dudes.
Okay.
Like you don't see built Indian dudes, right? These guys are like well-framed and like toned and like all of that. And it's so big in India, but it isn't like a global sport. I mean, even South African Indians don't know about it.
If it was in America, that would have been an Olympic sport by now because...
Oh yeah, they would have a World Series with Americans only, right?
Yeah, exactly.
So that was quite an interesting, and when you start seeing sociological interventions that can have a health impact, I think that's when you start thinking in a much more transdisciplinary play. In Brazil, I got to work with the Ayrton Senna Foundation, which is sister runs, and so it's been quite an interesting journey.
That's really cool.
So how many countries have you lived in? South Africa, the UK?
Oh, no, I mean, travel to... I lived the UK, the US, New York and DC and South Africa, but traveled extensively.
Okay, so you traveled.
Yeah.
You traveled there quite
spent a lot of time in Paris because that was a nice hub and helped set up a French office of the Global Business Coalition.
Okay. So fast forward all of that. What brought you back here to South Africa? And initially, as you said, Johannesburg was like, such a wow factor for you. You want to be seen
no, that's too close
and not heard. I mean, you traveled to the most phenomenal places on earth, lived in the UK and the States and, well, Paris now, as you say. But Johannesburg has brought you back. What made it bring you back? Because how long have you been here for now?
It's been 4 years since we returned.
Okay.
Just to finish DC, after the Stratcom and then after Global Network for Neglected Tropical Diseases, I became a professor at Georgetown University in the Department of International Health. And that was nice because, and I was literally a proverbial sort of tweed jacket, riding my motorcycle down to the university, teaching my courses, engaging with colleagues. But it was nice. I didn't have to travel much and the babies were there, all three of them, and I just wanted to spend time with them. But that's when I also started a new master's, and that's in Ayurvedic medicine.
Oh.
And so I finished that 3 years ago.
Did you just get bored or?
That ADHD mind, man. So,
are you genuinely ADHD or are you just using it?
No, I'm not on treatment or diagnosed. And as I read up more about it, I don't think I am. I think I'm just curious.
Yeah.
But
So it's curiosity that.
Yeah, and just like wanting to know about stuff, right? But when you start looking at health, right? And it was good old Hippocrates that said food is the best medicine.
Okay.
Somewhere along the line, I did half a master's in liberal arts at Johns Hopkins.
Right.
But then the babies started coming, and so I needed like 6 courses. I did like 3.
Okay.
But one of them was in ancient Greco-Roman and Egyptian medicine. One was on cosmos and cosmology.
Right.
Like just exploring the liberal arts is so much fun. But prior to Hippocrates saying food is the best medicine, it's written in the Vedas,
Okay.
right? That food is the best medicine. And so a lot of disease that we understand in the world, whether it's diabetes, metabolic syndrome, cholesterol, etc., even cancers, are related to our diet.
Okay.
Or the imbalance that we create in the body as a consequence of the diet. And so I looked at all these diets from Atkins to paleo to even blood group based diets, right? And I was like, how do we figure this out? We're all quite different constitutionally and all of that. And that's when I got interested in Ayurveda to say, well, do they have an approach? And so that's when I did this master's at the Maharishi International University in Fairfield, Iowa, getting into this entire field. And I think there's a lot of parallels and similarities with allopathic Western medicine and our understanding of the physiology, but there's also a different lens and configuration with the way the Ayurvedic approach is and the interventions. And so it's been quite interesting having that perspective as well. But coming back to Zach's question, after COVID, or in 2020 at the end of the year, we moved back here.
Yeah.
But in April,
you, Alison, and the kids.
Yeah.
Is she American?
She's American.
Okay.
And in April, I was chatting of 2020. I was chatting with my sisters. One's in the UK and one's in Sweden. And I said, I don't know if we're going to see mom and dad again.
Oh, that's deep. Yeah.
Right?
Yeah. Because
there were the lockdowns.
Yeah.
And COVID was taking the elderly. Right? And so, so by the end of the year, we were like, okay, this is our window to go see them. And I was speaking to them every day and trying to manage them and the care they were receiving.
They're still in Durban.
Joburg. Yeah. Okay. And so December 2020, when we got a window to travel, we came down here.
Okay.
And this was after a year of school shutdowns with 3 elementary schoolers learning online.
Their first time to Africa?
No. Naina had come before, but it was the first time for Zayn and Rohan. Okay. And so we go into a shutdown in South Africa, and then January schools open in South Africa in person.
Yeah.
And we said, well, let's see if we can get them in schools and they can at least get some in-person schooling. And they got into schools, yeah.
So this wasn't planned?
No.
Okay.
Right. And they started online schooling, and the weather was amazing, and they're playing field hockey and like all of that. And then the thought of them going back to school or online schooling in the US was just like, oh, we can't subject them to this. Yeah. And so I was still teaching at Georgetown, and I completed teaching that semester online. So there were 2 courses that were, one was at like 6 in the evening, but one was at midnight to 2:30 a.m. But, that was a small sacrifice to make. And then I finished my master's while I was here online in Ayurveda. And we just decided, okay, well, it's working out. Let's stay.
Yeah, it's the best place to live.
It's hard to argue with 9 months of summer in the year, right?
Yeah.
Well, not right now.
But it is interesting because it's not a choice on like in a rational way to say what's the best and what's the worst and like all of that, but it's how are you feeling,
Mm.
and make the best of it, right?
Yeah.
And that's sort of become a life, almost philosophy, like, my little joke is people are so preoccupied with what their destiny is or should be that when it sort of shows up and smacks them in the face, they're too blind to see it. Like your destiny is what's happening now,
Yeah.
right? As your journey unfolds.
Because it was peak load shedding at that time. There was a lot of load shedding
Oh, yeah,
happening. South Africa, people were not keen on it. Lots of people were thinking, I need to leave. But
But
here
we
you
were
are.
also just coming out of Trump back then, right?
Yeah.
And so when people often said to me, wow, you chose to come back.
What's wrong with you?
What's wrong with you,
Who
right?
did you kill there or something?
And then, and I was like, well, it's not too bad, yeah. And then, oh, well, we have this load shedding problem. I said, we came from DC. We had the Trump problem there.
Yeah.
I'll take the load shedding problem any day.
And
sure, it's inconvenient, right? But it's not soul crushing. It's not morale deflating in that sort of way.
Together. Load shedding seems like a very community problem here.
Yeah.
Whereas in the States, what you see going on right now is very divisional. There's a lot of people, whatever the problem might be, for example, these tariffs. There's so many industries that are basically being divided based on what one guy's decision is or wants it to be.
And hold on, doesn't Joburg have like the best people in the world? Or is it? No, because you're living in Joburg now, right?
Yeah. I love Joburg.
Joburg is the best.
I love it. When people tell me they don't like Joburg, well, I'm like, well, you don't like that Pan-African metropolis.
Yeah.
Do you know Time Out magazine?
Yeah.
They did the 10 best cities to eat in the world.
Okay. And Joburg was number one.
No, number one was Naples.
Yeah.
Number two was Joburg.
I heard about this somewhere, and some people were like,
I'll give it that.
There's nice restaurants. The value for money is amazing. The diversity is phenomenal. We have huge West African, Pan-African influence as well now. We have the best of Western Europe.
Look, at one stage we didn't have functional traffic lights, but I'm telling you, it's the people here. Joburg has a reputation for, I guess if you're not from Joburg, people elsewhere in the country think that it's like the big smoke. It's a rat race. They're stressed out people, but they're the friendliest people I've.
They say that, and you must tell them to go back to Pietermaritzburg.
Oh, wow.
Well, that's a dig at Yak, right? Okay, so
I'm from the Bergs.
You're from Maritzburg, aren't you?
No, I think Joburg is the best. I mean, I've lived in 3 provinces. I've lived in Pretoria, lived in Joburg, lived in Durban, lived in Mpumalanga. So obviously not all over the country, but...
Right. And the nice thing is you can escape the city like in half an hour, 45 minutes, right?
Yeah. Okay, so then you come here, you move, you settle down. Is this it now? What's next?
Well, I don't know.
Yeah.
I mean, when you look
Definitely
at the trajectory, like the whole notion of settle down and forever is like, but I do feel this is home, and this is where we are now, and the kids are comfortable, the wife is happy, I mean, I'd be cautious to return to the US.
Okay. But you can always go back if you want, right? You've got that.
I think there are many options open. During his first tenure, I did spend a lot of time with Ibrahim Rasool, Ambassador Rasool.
Yeah.
And
he kicked out now recently.
Yeah, he was classified as persona non grata and like all of that. And that's a much more deeper conversation to have. But I would be cautious to return to the United States now, and with everything that's happening.
I probably got ahead of myself by asking what's next, because what is happening now? What are you up to now? I don't know.
I'm just having a good time with my dentist.
Having someone.
Yeah. Like, what do you?
Either my dentist is really cool or my dentist thinks I'm cool. But anyway, we're hanging out.
Yeah.
But
are you practicing, or what's the situation now? Yeah.
Yeah, that's what I wanted to ask. Are you affiliated with Pretoria at any? I mean, that's what Chacharji said.
So I just finished a 3-year stint and finished off in Pretoria in November. And that was a transdisciplinary platform. And so from the story about my career and like what I've done, transdisciplinarity lends itself very much to that sort of much broader lens and integrated thinking. So one of the things, so transdisciplinarity is almost, I want to say, a cultish part of universities, because the way we've organized our study at a tertiary level is in these disciplines, right? And transdisciplinarity is saying, no, if you want to really tackle big issues, you have to start thinking in a much more integrated way. And we're not saying that at the cost of our disciplinary approaches. But each discipline is an entity, a universe unto its own or on its own, right? And to break those silos is actually quite hard. It's a cultural shift. It's a mindset shift. It's a different lens type of thing. And so transdisciplinarity approaches is about saying, how do we look at that in a more broad way? My favorite example to talk about this, Yak, I may have mentioned, is as a doctor, you ask people to wash their hands. Only a few people wash their hands to prevent germ transmission. You bring in a priest, and the priest says cleanliness is next to godliness. Everyone washes their hands, right? I'm agnostic to why they do it.
Yeah.
I just need a particular outcome, right? So we have to think about things in a more sort of global, multi-perspective way. However, one of the tenets of transdisciplinarity is that it needs to involve an extended stakeholder group.
Okay.
So it's not just academics and PhDs deliberating the stuff. We have to have civil society, indigenous knowledge systems, business sector, non-profits, all of that involved. That's when the magic happens. But the problem with the study of transdisciplinarity, and I corrected myself to say practice, right, is that it remains in the university environment.
Okay.
And knowing the hierarchical nature of universities means that it doesn't create a welcoming or equitable platform for multi-stakeholder engagement, right? And I think that frustrated me to a large extent. And I'm not a traditional academic by any stretch of the imagination. And so for me, it's about, I'm more of a practitioner. And how do we get things done? How do we bring the people type of thing? And so I think there's a lot of potential for it, but I think sometimes it's hard for university structures to get out of their own way.
Okay. I see you as
that was actually quite diplomatic.
I see you as well,
what an answer.
Well, that's great tiptoeing. Yeah. I see you as a strategist and an influencer. Like if I had to sum you up in 2 words, strategist and influencer.
Yeah.
But what are you doing now? So are you up to anything or are you just chilling?
Come on, yaar. What about totally cool dude?
No, that too. That's fine. I mean, you're pretty cool.
Yeah.
So it's nice to break out into an Indian accent every now and then.
On accents, it's interesting that you haven't, I mean, you've got the South African accent. You don't go and twang there in the US and then come back here and speak like a South African.
I had a bit of the British accent.
You know why? Because Yak is a twanger.
Oh, gosh.
Yeah. I'm going to keep on, this is going to be he's a twanger. We said it in the last episode.
Like residual sibling rivalry, cousin brothers.
Yeah, we are like cousin brothers, but he's a twanger. You'll see. He's got a podcast.
No, but I do find that it depends who I'm speaking with, just in a way of being more understandable. So not just the twang, but you would use phraseology that...
dialect.
See,
it's about connection.
That's another diplomatic way of saying you're twanging. But now it's code switching. I get it. Okay. All right.
Well, I just wanted to say, before we move on from that point and close off, I can relate to what you're saying about, that translatable MO of having something from academia or developing something and then getting it translated into just a man out there that actually needs it. For example, like recently I've been exposed to the Public Enterprises Department. And they want to do a whole host of different stuff with regards to amputees, especially because I'm an amputee. And I bought this machine here sitting behind us. It's a 3D printing machine. And we get all of these STL files coming in where there's art developers that are sitting in the States and Dubai and whatnot. And they send us these files and we 3D print it, we tweak it ourselves, but we 3D print it and we kind of test it out on ourselves. And the functionality that it gives me, for example, holding this cup, for example, it allows me to hold this cup and drink with it. But obviously, I want a lot more than that, being me. But that amount of, or that advantage that it gives me just by enabling myself to hold this cup, 80% of the people that are waiting in the public sector for an authorist to get this done for them almost doesn't exist. And that is because it's all stagnant in the academic phase of the processing. Private sector hasn't gotten involved to buy someone a 3D printer that will lower those costs to get this technology available out there to the people in order for them to go in, get a little scan done, a 3D printed scan done and print something that's made out of a PRF material that's going to cost about 20 cents on the rand to print. But that is where now I'm starting to see all of these different aspects of society coming in and playing their part in order to create a end goal.
That's beautiful. And I think there are a lot of private investors and philanthropists in South Africa that would put money behind that.
Yeah, well, the unfortunate part is, maybe we shouldn't mention this on the podcast, but the biggest philanthropist that's trying to, propagate this whole, what are you going to call it? Technological advancement is the same guy that's kind of stagnating America right now. And it's ex-South African, if you want to call him that. But it's unfortunate that is where it is right now. But at the same time, you can see the technology behind it. You can see that there's good trying to be done. It's just that it's a little bit misguided at the moment.
So
that's not an opinion.
And there's a lot of other philanthropists one can look at, and I do think, there's a lot of people enamored by technology, right? And there's the appropriate use of technology, right? Not technology for technology's sake. But that only comes from engaging a wider audience. Speak to amputees. Speak to that mine worker who lost his arm, or mom who's taking care of a kid with an amputation. And that innate knowledge, that instinctual knowledge, is so important that informs our use of technology. And many a time there's been, here's cool technology, let's find what we can use it for, as opposed to let's look at our problem and what we're trying to solve and find technology that will suit it. So I think that lens is important. One of the things I think that's really an important consideration for us in a South African context. So we had an all-time low with trust, right? And it's not just South Africa. You look at the United States or other places in the world. And what we need to think through is what is a new form of governance. And this is what I've been sort of pondering a bit now. And so, yes, we have government and we have a GNU. And the GNU, I think, is making good progress, because when you look at coalition governments around the world, there's some good success stories, right? They're forced to collaborate. They have to figure this stuff out. But that's just government. Then we need to bring in business sector from different industries and civil society and the layperson and people living with disease, right? And this is one of the most important lessons we have from HIV. You cannot form any HIV committee, council, organization if you don't have a person living with HIV involved in it, right? And so when you start looking at all of that, and I think one of the big things in South Africa is it is a country of faith. Right? People take their religion seriously in South Africa, across all religions. And we need to bring that into the governance process. And I mean, you look at one of the most important transitions that we had was the Truth and Reconciliation Commission. And if the good Bishop Tutu wasn't chairing that, would it have had as good an impact or success as a process? So we need to think creatively about all societal actors and how we configure it in a way that reestablishes trust, that promotes good dialogue, right? We've stopped having conversations or talking with each other.
Just fight.
We talk at each other,
Yeah.
right? Online and through fora, but we don't sit down and have the conversation type of thing. So I think there's a lot of opportunity for that. And just the simple example of the prosthesis you're talking about, that's the principles, the same principles apply.
Yeah.
Sorry, I
No.
spin a bit.
I liked it. I liked it a lot. I only realized that this country was very religious when I moved to work in a company that's in Pretoria. It was just an eye-opening experience for me. I just never realized it. But you make a very good point there. Faith is a big thing in South Africa. If you can tap into there, yeah. Anyway, let's not go there. But this is the third time I'm asking this question now. What's currently happening? Are you chilling? Is it a no-go question?
No, I think it's a fair question.
Are you registered here to practice, or do you practice and all that? Yeah. HPCSA.
So I have all my registrations up to date and all of that. So I have a few different roles, and I think I have a colleague in the US who calls himself a polymath doctor.
Yeah.
And I think for people like myself, yourself included, Yak is not too far behind. It's about a portfolio of work rather than a job.
Okay.
Right?
Yeah.
And that's what keeps it interesting. And it's the cross-pollination of ideas.
Yeah.
I think that's important. And so at the moment, I'm consulting.
Okay.
I have a trip coming up later this month to Kerala.
Yeah.
Where I'm going to be in an immersion environment with Ayurveda.
Oh, okay.
And
is that the home of Ayurvedic medicine? Or no?
The South and
South.
Kerala particularly. There's parts of Gujarat and all of that also have little foci of it. You gotta love South Africans because we love our cheesy puns.
Mm-hmm. Yeah, of course.
Right? Then when you become a father and you get a dad sense of humor together with a cheesy pun, you just take it to another level.
Dad
right?
jokes at another level. Yeah.
But it's I'm sort of incubating this medical approach to things.
Yeah, that's a good play on it.
Right? And how do we bring the best of both worlds? Because they are complementary. They not on an equal or equitable engagement level. And how do I create a practice and a learning academy that embraces both in a way that's a bit more structured? And so I'm looking at that now. Okay. And I also want to see, and this is where my advocacy past can't always comes back to me. This is also an important collaboration for South Africa and India as part of a big BRICS platform to ensure that we bring our indigenous understanding and knowledge to things, and at the same time be contemporary in the world that we are today. There's one of my favorite philosophers, or two. One is J. Krishnamurti.
Okay.
Love him to bits. And then the other is a guy called Jacob Needleman.
Right.
Jacob Needleman wrote a book called The Way of the Physician. And it's just a beautiful read. It's a tough read because it's like a philosophy book, but it's beautiful once you get into it. And Ayurveda also talks about this, where they say the number one priority you have in this life is to take care of your physiology. You take care of that, everything else will fall into place.
Okay.
Your understanding, spirituality, your engagements, life fulfillment, self-actualization, whatever you want to call it, right?
Yeah.
But it starts off with taking care of the physiology. But in understanding of how you take care of your physiology, you have to have a spiritual worldview,
Okay.
right? Because that's the basis of your physiology. And it's not chicken or egg, it's circular, right? It's reinforcing. And so I do think that it has a reflexive action to say, well, to what end? Why do you want to live longer? Why do you want to live without disability? Which comes to my last point on global health.
Yeah.
We look at two metrics in global health, right?
Okay.
Morbidity and mortality.
Right.
Life expectancy and living without disease, right? And I've been toying with the third M. So morbidity, mortality, and meaning.
Oh.
Right?
Yeah.
So what is the life purpose?
Yeah.
And what are we supposed to do here? And so that's kind of like, there's no one answer. And each person finds that own answer for themselves.
Yeah.
But I feel we don't place enough emphasis on the asking of the question and the self-questioning to figure that out.
This is such a coincidence. My 5-year-old asked me today, Dad, why are we living? And I said, I don't know.
Why?
I said, then my wife says, why you? It's an interesting question. Why do you ask that? And she doesn't explain why she asked it. And I said, because you're a philosopher, aren't you? And she says, yeah, I'm a philosopher. But yeah, she literally asked that today. Why are we living?
Right? And we don't need a PhD or a dissertation. You need to be able to have that conversation with a 5-year-old, right?
I just said, I don't know.
That's how guttural, that's how instinctual it is.
Yeah.
And we get so caught up in the life cycle of attainment and achievement that we forget that core human instinct to say, well, what does it all mean? And to what end?
Okay. So when I always ask every guest this question, and I'm going to frame it in this way because we've got 3 kids. I don't know when they'll get to this age where they're going to ask you the question or come to you and say, Dad, I'm thinking of doing medicine. Do you have any advice for me? What would you say to your kids if they come to you and say, I want to do medicine? How would you answer that or guide them?
Well, the best way to deal with kids is to answer a question with a question.
Okay. Yeah.
Why do you want to do that? Where do you see yourself going with this? How do these subjects resonate with you?
Okay.
How do you feel about engaging with people? What about the science enamors you? Lovely Indian. So there's an entire genre of Indian doctors who became writers.
Okay.
Right. One of them is Abraham Verghese.
Right.
And he wrote a book during the AIDS epidemic called My Own Country. One of my favorites is Cutting for Stone.
Okay.
Cutting for stone was actually a phrase that was used for removal of renal calculi, kidney stones, right?
Yeah.
But he's a beautiful writer, but he's been pushing this agenda at the Columbia Medical School on narrative medicine, right? It's how we talk to our patients, and it's beyond just bedside manner, but it's journeying together.
Yes. What does cancer mean to you? You've been there. What does it mean to you?
Exactly, right? And then the other really amazing writer, and he's passed now, is Paul Kalaniti.
Right.
He wrote When Breath Becomes Air.
Yes, my sister said I must read that.
You must read it, and besides being an amazing book, on the subject matter, his writing is literary value. Atul Gawande's Being Mortal is also really nice. Complications and checklist and all that is also good. But Being Mortal starts getting to those questions. What does all this mean in the life journey? So I think it's quite the exploration into those questions, coming back to if your child says they want to do medicine. But I do think the emotional maturity that we have to enable and foster in children of that age where they start thinking about careers is also really important. And I would say gap years, doing general undergrads before getting to medical school,
Yes.
all are self-exploration before deciding on a career. I think job shadowing is also really important.
Yes.
So they start to feel it. And then there was something interesting I read many years ago, that people don't think about the study of medicine as a career unto itself.
Okay.
It's 6 or 7 years,
Yeah,
right?
yeah, yeah.
And you have to think about that journey as well. Two very interesting facts in the South African context. The highest rate of dropout from the medical profession in South Africa.
Mhm.
Which cohort?
Probably just after university.
Yeah, after graduation.
Yeah.
Right.
Yeah.
But which
Oh, you
group
mean-
of
okay.
people? Yeah.
You mean from a demographic
Yeah.
perspective? I'm going to say Indian female.
Yeah, an Indian Muslim female,
Yeah.
Oh,
right?
Okay.
And so their life journeys, right? And I'm not judging right or wrong; it's subjective, right? Means that the practice of medicine in the hospital setting, etc., doesn't gel with that. What's the second biggest dropout?
I don't know. They would need the money. Oof, I shouldn't think out loud. Yeah. Maybe Afrikaans.
No, you're
female.
close to it, actually. It's African men, black men in South Africa, because medicine offers a huge credential and an opportunity to accelerate income, right?
Okay.
But it hits a ceiling,
Yeah.
right? Right. So as doctors, we're not going to be corporate lawyers or investment bankers, type of thing, but we'll be an above average income. But once they have that credential to get capital and everything, it's opening up franchises and chicken lickens and like all of that, which become much more lucrative
Okay.
in the longer run. And then it requires supervision and all of that. I mean, what is frightening about our field is that university application rates have gone down over the years.
Oh, is it?
Right. And people, not just in South Africa, I'm talking globally, but people want to go into finance and banking and all of that. And the way we portray and present these professions on social media and the way they are presented is, well, this is how you make big money, which buys you the fancy car and this makeup to use, etc.
Also, medicine has a very bad reputation. It needs PR in this country because people are talking about unemployed doctors and you're going to be slaving away, whereas the investment banker will be balling and making millions.
Right.
It doesn't have good PR. So, okay, but you'd probe the kids. You wouldn't just say, don't do it. That's the point. Because a lot of doctors have that tendency to tell their kids, nah, don't get into it. And dentists.
Yeah. So it was just this afternoon. I was talking to my 15-year-old. We were having a conversation, and she said, "Well, if you say that, or if you're going to go that way, I'm going to resist." Right? And and that was an age-appropriate answer.
Yeah.
And so I know better than to say no, don't do it, right? Because that's going to push them more. But I do think that part of being a parent is about how we help them explore about themselves, right? And it's through questioning, it's through presenting yourself and making yourself vulnerable that sort of gives them those insights and helps them sort of question those things a bit more.
Fascinating. Yeah, I like that answer. That was a great answer. Yak, any closing questions?
Yeah. No, well, maybe not a question. It's a request for a free consult for the Ayurvedic medicine part of my Ayurved. Yeah, my vegan and gluten-free diet that I've gone on this journey with. But that's a request. Free consultation once you come back from Kerala. But it's been great having you, Neeraj. Thank you so much for gracing us with your presence. And I didn't know about 80% of what you had spoken about. And this is why I wanted to find out. But I'm so pleasantly surprised that we had this chat because, you think you know a guy. You think you know a guy. Yeah, but thanks for being here with us.
Yeah, it was fascinating. I enjoyed it. I'm actually, to be honest with you, I'm cutting this conversation short because we're running out of memory And that's why it might seem like an abrupt end. I want to talk longer, but I appreciate you being on the show. People are going to love it, I think. Yeah.
Well, happy to be here and always happy just to chat and connect with people. That's what we're here for, right?
Thanks so much.
Absolute pleasure.
Cheers.
Yeah.
Sante.
Cheers.
Let me press stop here.
We'll have a part 2 when we come back from Kerala.